Hello, our topic for today is should a free and appropriate public education, also known as Fape, be included in mandatory ABA services for children and youth with ASD in schools? My name is Dana and I will be playing the role of a clinical director in today's debate, and I am pro ABA services through Fape.
My name is Rhett Theobald. I'll be playing the role of the school administrator in today's debate, and I am con ABA services through Fape.
My name is Shauna Lane, and I'm playing the role of the BCBA in today's debate, and I am pro ABA.
My name is Sammy Gates, and I am playing the role of the special education teacher, and I am con.
My name is Heather Drury. I am playing the role of the parent, and I am pro ABA in the school. I do apologize. I am having technical difficulties today, but you will be able to hear my voice throughout.
My name is Janelle Schnabel, and I will be playing the role of a general education teacher, and I am con ABA services through Fape.
Free appropriate public education, also known as Fape, is special education and or related services designed to meet individual needs for each student at no cost to you. Guaranteed to all eligible students with disabilities by the Individuals with Disabilities Act, also known as IDEA. Fape is a publicly funded and individually designed educational program developed to meet the unique needs of eligible students with disabilities. The Individualized Education Program, IEP, is the process and document that defines a Fape for a student. It is the collaborative process in which students, personnel, and parents design the student's appropriate educational program. The purpose of the procedures is to safeguard a student's rights to a Fape by ensuring that parents are meaningfully involved in the development of their child's educational program. As school administrators and educators, their role is to provide every student with the best education possible. Unfortunately, though, however, many students with autism or on the autism spectrum slip through the cracks every year, severely challenged or put into special education classrooms alongside students with other learning disabilities. ABA therapy can offer a treatment that is proven to significantly help the symptoms of autism spectrum disorder, even allowing many students with the disorder to function within a normal classroom setting and to learn alongside their typically developing peers. For today's debate, the background is that the IEP is already in place and that we are discussing our main stance that ABA services either need or do not need to be in the school under Fape guidelines.
So to answer the questions directly, through schools should have a mandatory ABA services for children diagnosed with autism. Schools require the IEP for children that are eligible. IDEA defines special education services as design instruction. So with the IEP in place, we are meeting these guidelines. Let me explain the process to get the IEP in place. To get services, you need to meet the following guidelines. You need to have a referral, you need to have an evaluation, you need to have eligibility, you need the development of the Individualized Education Program or IEP. There's an IEP review and there's reevaluation. I believe we have a visual to be presented. Let me look at each one of these topics individually. The referral ensures all students are identified, located, and evaluated. The evaluation is done under specific guidelines to assess the children's needs. Once the evaluation done, they could be eligible if they're found to have a diagnosis with autism or a developmental delay or several other disabilities, then they'll be eligible for the IEP program. When you get to the IEP program, you develop a team. The team consists of the child, the guardian, special education teacher, a general education teacher, a representative that is knowledgeable about the curriculum or instruction, which could be like the BCBA or a clinical director. And you can also have other individuals that the guardian would like to have in the IEP. Your child's school will take steps to make sure that you have the opportunity to participate in the creation of the IEP. You have the right to be notified of the meeting in advance and have the meeting at a time and place that is convenient for you. The goals of the IEP are based on your children's current level of performance and should be measurable. These goals should help make the progress in general education curriculum is reasonable accomplishment in one school year. The IEP has designed a method on how to measure these goals and make sure that they are met during that year. The tracking method is included in the IEP. The IEP team also discusses how to implement the IEP to be most effective. The goals can be academic, behavioral, social, and address self-help or other educational needs. If your child is participating in an alternative assessment, there will be goals, objectives that support that assessment. The IEP will give a start date, how long it will last, and how often the services will be done. Special factors that are included in the IEP includes the strategies for behavior management and certain communications that are needed if the children needs that. The IEP is reviewed on an annual basis, and there is an option for reevaluation.
I appreciate the services that the IEP can offer to my child. However, I'm legally obligated to send my kid to a school once he hits 6 years old, and the progress that he has made in ABA versus what he's making in the classroom is pretty substantial. I would like ABA services to be part of his IEP. According to the Rowley case of 1993, it seems that there's really only minimal progress required for a student in the school, and these what are considered appropriate services are substandard and don't even meet the basic communication needs of my child. He gets 20 minutes of speech per week. I don't see how that can be very effective. While it's understood that Fape doesn't need to meet the maximum benefits for a child, I really think it should be considered that it's possible if a child isn't even meeting minimum requirements that the teaching style or the environment perhaps is not conducive to his learning. ABA is built on the notion that through repetition and appropriate training, individuals with autism spectrum disorder can increase or reduce their target behaviors. The methods being used now in the school aren't showing progress, and the IEP goals are not being met, and I don't feel that the school is offering any additional troubleshooting methods. So why not implement ABA, a method that's scientifically proven and one that he's already shown he can thrive in?
So as a special education teacher, I find I have many of the same responsibilities as a general education teacher. However, my role affords me the ability to work one-on-one with the children in my class. So typically my class size is smaller, which allows me to give them the specialized attention that they may need that they wouldn't find with the general education teacher. The special education gives the students the opportunity to be provided with structured and really contrived opportunities to learn. So we're setting our students up for success and giving them a chance to practice before they get into the general population. Students then have a chance to practice desired behaviors within the environment. And so I am able to then be utilized also by the general education teacher within the Main Street classroom to support our students as they transition. My role also includes making a lot of modifications to instructions and the methods that we use to teach our children in our special education classroom. And we're really trained in behavior management and handling children with disabilities.
To add to the special education teacher here, I have access to her, and she is someone who is very knowledgeable in a variety of disabilities per her education. She's someone who can individualize your child's school plan for their needs. That way they can get the appropriate education in my classroom. With these collaborations between the special education teacher and myself, among others that are experts in their field throughout my general education career, such as the school psychologist, the speech and language pathologist we have here, the occupational therapist, and the physical therapist, I have learned many skills on how I can possibly help your child succeed in my classroom. Over the years, we as a team have implemented many different interventions and teaching strategies, and we have a very large toolbox to pull from. I also believe that even a small amount of training at specific times throughout my career relating to a child like yours who has autism has increased my knowledge of autism spectrum disorders as well as other disabilities. I have also done a lot of training in the recent years, learning from evidence-based practices, as well as how to decrease overall stress and anxiety levels of all of those included. Specifically with the integration of students with autism that are coming into the general education classrooms, such as mine.
There is no treatment for autism that is more widely accepted and approved than ABA, and the simple reason for this is that it is scientifically proven to be effective. Many children who receive the treatment go on to learn successfully in a traditional classroom, and most carry the skills that they learn with them well into their adult lives, using them throughout their careers and adaptive skills and their independent functioning. ABA therapy is highly recommended for all children with autism spectrum disorder, and many school districts have learned that the methods taught can be effective for other children as well. ABA is most effective when it's offered both at the home and in the school setting. Most children have an excellent chance of seeing a significant improvement in their behavior as well as significant reduction in any sort of undesirable behavior or symptoms. ABA therapy is a unique and efficient method of teaching. It works through discrete trial training, which is a series of lessons that breaks common behaviors and actions down into the most basic steps possible so that it can be taught gradually and systematically. Positive and appropriate behaviors are rewarded with praise and positive attention. This helps the child start to associate proper behaviors with positive attention and will help them learn to behave in acceptable manners. More importantly, over time, this will help the child's brain start to build new neural connections that will help teach them to infer proper behaviors and will actually help make it easier for them to learn appropriate behaviors and concepts on their own in the future. So again, we're really just setting that child up for success. There is no treatment for autism that is more widely accepted and approved than ABA, and the simple reason for that is that it is scientifically proven to be incredibly effective.
Developed in the 1960s, ABA is an evidence-based practice that can be used by individuals in the classroom or clinical setting. The Code of Ethics 2.0 talks about responsibility to clients, which includes providing services that are in the client's best interest. According to Mendelowitz, the cookie-cutter approach to special education will not and should not be acceptable. The program should fit the child's individual needs. One of the major benefits of ABA is that each client is seen as an individual. For example, they have individual behavior plans and individualized goals to reach. For students with disabilities, in order to implement services, we would conduct an FBA using the FAST method of testing. It just takes a few minutes, so they're not going to miss many academic learning opportunities. The information gained from the FBA will be used to determine an operational definition for any and all target behaviors to ensure that those collecting the data are doing so on the same occurrence of behavior so that everyone knows what they're tracking, and the function of the behavior, which is basically determining why the behavior is happening. And the maintaining contingencies, which are things that might be in the environment or particular people that are maintaining this behavior. The information is crucial in writing the Behavior Intervention Plan, or the BIP. The plan will include what to do when the behavior occurs, according to the definition, preventative strategies to help manipulate the environment to decrease the likelihood of behavior occurrence. So for example, if you have a child who is highly distracted by seeing their reflection in the window beside their desk, maybe you should move that child away from the window so that they can no longer see their reflection. These behaviors will be assessed according to what is deemed to be the most urgent need. For example, behaviors that are putting themselves or others in danger would obviously be the first ones we would need to address. As the BCBA, I am prepared to train individuals to implement the individualized behavior intervention plan. We would focus on socially significant behaviors and personalize a plan for the child's needs. Behavior plans are easy to implement, and when they're done correctly, can be very successful. The individuals who will be working with the student will be trained and should be observed to ensure treatment fidelity, or just basically assuming that the BIP is done correctly. The immediate family will have an opportunity to meet with me, and I will give them a copy of the BIP and train them so that they can implement the BIP in the home setting, so everything will be as consistent as possible.
ABA, or Applied Behavior Analysis, isn't just for students with autism, and I think that's a point that gets overlooked very commonly. It can directly relate to the mainstream classrooms and students as well, and it can really also help the teacher when they're teaching in mainstream or special ed classrooms. ABA principles and methods that are effectively applied within an educational setting can lead to accurate assessment of skills in the classroom across all areas of functionings. This will also show you those skill levels that are oftentimes much below grade level for a lot of students. Individualized curriculum for systematic skill development across all play areas. This includes play, motor skills, communication, speech, behavior, academic skills, and social interaction. ABA can help teachers simplify and break down various curriculums and or particular targets. For example, an ABA approach can help by analyzing and helping teachers by identifying what to teach, why specific goals and skills are targeted, how to teach and measure learning. This includes accurate data collection and analysis, when and how to generalize skills outside of the educational setting or classroom setting, where to go next, the next steps to take for the child or even a classroom's continued success. Generalization of skills is another major advantage that ABA can support. The generalization of skills learned inside the classroom to outside of the classroom would benefit all the students, again, not just those labeled on the spectrum. ABA techniques can provide teachers with detailed assessment along with both proactive and reactive strategies for the remediation of challenging behaviors for all children. This again is both in the special education classroom and the mainstream classroom. Some of these challenging behaviors that can be seen in both classroom settings include self-stimulatory behavior, self-injurious behavior, aggressive behaviors, and or other attention-seeking and maladaptive behaviors. It's the most effective when it's offered both in the home and at the school. Children who are on the spectrum stand an excellent chance of seeing a significant improvement in behaviors as well as a significant reduction in other symptoms. The ABA strategies being implemented more times than not are again easily blendable within a typical classroom and can be shaped to fit a variety of different teaching styles.
ABA isn't the only therapy option that can be used. Schools offer several services like occupational therapy, physical therapy, and speech therapy that all benefit any student with a disability. So occupational therapy really works to help a child develop and maintain daily living skills that are necessary in their lives, with the end goal being that the child is independent. So they can work to help children learn to organize, manage, perform their daily life activities, and a lot of the services focus on education as well as leisure, play, and social participation. The nice thing about having occupational therapy on site is that the occupational therapist can come into a classroom, and if child in the classroom can practice these things with their other peers. There's also speech therapies, which focus completely on speech, working to help a child talk. And there's extensive training in the techniques to help develop speech. So while ABA can combine these views, they really just give a general overview, whereas these specialties can focus individually.
IEPs are often referenced for academic issues and goals, but rarely from a disciplinary angle. According to a study by Dalton and Lehman in 2013, behaviors often worsen over time and students can become so discouraged that they no longer engage in the learning process. The problems that teachers face is to find a way to keep the kids motivated to learn while still conducting teaching activities for the whole class. Having a behavior analyst or a therapist there to help deal with behaviors based on the function will help the teacher's job move on a little easier and cause less frustration for the student that is in need of the support. ABA can be used in a variety of settings, as we've stated already, and with a variety of individuals. Goals can expand from social goals like play skills and eye contact to classroom behaviors such as raising your hand, and group skills such as setting appropriately and quietly in a group setting. Students with disabilities can receive one-on-one supports.
Thank you for those points. The issue comes exactly down to that, the appropriateness that Fape requires. And due to the comprehension issues, the social deficits, sensory processing challenges that my child faces, we're seeing that the mainstream classroom is actually not the appropriate fit for my child. And as Shauna just said, the ABA is scientifically proven to address these specific ASD issues.
I would like to say something. I believe teachers are the most important factor in an inclusive setting at school, but it is very difficult to keep up-to-date training for the increased needs of those coming into our classrooms, including your child. My responsibilities have changed a lot in the recent years, and my responsibilities are not just to teach those without disabilities, but also those with them, which makes me take on the role of a special education teacher. I believe that teachers in general education classrooms should only feel responsible for part of our class, while the special education teacher, who has the most training with different and various disabilities, should be responsible for those individuals who have different and sometimes specific needs. Most general education teachers lack the knowledge that most special education teachers have. So in working collaboratively with them, we may be what's best for the student. One option that I think would be optimal is for myself and the special education teacher to work collaboratively to provide the most inclusive setting for your child. That will give your child the best education in the classroom, as well as an individualized education that will help them succeed. I also think that it would be beneficial for me that if I know that there's a child coming into my classroom with a certain disability, that I would be provided with a few weeks of in-service training per year. And that would be useful to keep us up to speed on different interventions and ways to teach these children. Another issue that I have come across is that we are not made aware of what a child is expected and not expected to do in an inclusive setting, such as in my classroom. Getting something that fully explains what your child will and will not participate in with his or her peers in my classroom would be beneficial to not just me, but to everyone involved in implementing their IEP in the school. I think it would make me feel like we have more of a collaborative team and that we are all working for the same goal, which is to help your son meet in academics.
As an ABA, I can provide data on specific behaviors at specific times rather than just data for the overall school day, because there will be an aide or a therapist with that child at all times who is collecting data. This helps to identify if the behaviors are happening during one specific time more than another, or it can also help identify some of the functions of behavior. Data can be collected on new behaviors, or if the topography changes for a target behavior, that just essentially means that if the behavior looks different or begins to change a little bit, we can determine from that if the function is changing. This data would include an antecedent, which is what happens right before the behavior itself with as much detail as possible, and consequence, which is what happens right after the occurrence of the behavior. During a typical day in a classroom, there are various interactions and behaviors that a child and or his classmates must navigate through, and the aide or therapist should be able to step in and appropriately assist and prompt the child as needed to help them be as successful as possible. And collecting all of this data and seeing all of the data points on the graph and determining functions of behavior can all help tie in to make that child a success.
The special education related services, accommodations, and modifications your child will receive. In this part of the IEP process, the team will determine how to put your child's IEP into action. The school board must provide a free and appropriate public education, or FAPE, for your child in the least restrictive environment. This means that to the maximum extent appropriate, the team should figure out ways for your child to participate with children who do not have disabilities in a general education setting. This part of the IEP also includes an explanation of the extent, if you're any, that your child will not participate in the general education class. The IEP will also include the date that your child's special education services will begin, where and how often they will be provided, and how long they will last. During the IEP review, the Individuals with Disability Education Act, or IDEA, an IEP meeting must be held annually. At this IEP meeting, the team will look at your child's goals and determine whether or not they are being achieved. The IEP will change or be updated to include new goals, new evaluations, information, and any other relevant information about your child. You may request an IEP review meeting at any time in order to revise your child's IEP. They can refuse this request, but must be provided with a written explanation of the reason it was denied. During reevaluations, you are a representative who can request a reevaluation to review your child's educational or related service needs. The reevaluation will typically not occur more than once per year and should take place every 3 years, or unless you or their representative agree to the reevaluation is not necessary.
I do believe that once per year is completely inappropriate for academics, but more so it's downright unacceptable when it comes to behaviors. A 2011 study by the Department of Education and the Office of Civil Rights showed how often students with disabilities are restrained in the public school system. Can we please show that visual? As you can see, even though only 12% of the students enrolled were served by the Individual Disabilities Education Act, 75% of the students that were restrained in the classroom had disabilities. This is significant to me as a parent of a child who's prone to outbursts. The current behavior plan that we have at the school is evidence that the school staff is not competent in the area of behavior reduction. My son is throwing his work off his desk in order to avoid doing it. And your staff responds by putting him in timeout, which means what? Basically that he gets to avoid the work. That's what he was trying to do. ABA consultation would arm the school with the knowledge of behaviors and their functions. That knowledge could allow you to put a plan in place that would likely reduce these challenging behaviors. As things stand right now, at the very least, these behaviors will continue, and they will likely even increase. And at the risk of sounding dramatic, I do have concerns with behavior increase. The following video shows that what can happen when a child that does not follow school rules and a staff that doesn't know how to help him cope, how that can get out of hand.
It's the hard-to-watch video shocking America. A third grader in handcuffs, crying in pain.
There is outrage this morning across the country as well.
Children with disabilities were handcuffed at school for misbehaving. The boy is only 8 years old and suffers from attention deficit hyperactivity disorder. When he threw a tantrum, a sheriff's deputy assigned to the Kentucky elementary school put the cuffs on him.
Now, you're going to behave the way you know you're supposed to, or you suffer the consequences.
Look, his wrists are so thin, the cuffs are placed around his little biceps. Listen to what the deputy tells him.
If you want the handcuffs off, you're going to have to behave and ask me nicely.
The shocking video was released by the American Civil Liberties Union. ACLU lawyer Matt Coles.
How could anybody think this was the right way to handle an emotionally distraught 8-year-old? You talk them down, you de-escalate, you get them calmed down. I think almost every parent and every teacher knows that's how you do it.
It turns out that thousands of school children are handcuffed every year. This isn't an isolated case.
Not an isolated case. The Department of Education estimates that 50,000 children were forcibly restrained last year, and everyone agrees that that's a gross undercount.
Cases like this 12-year-old boy taken away in handcuffs after throwing sticks at a counselor at his school in Orlando, Florida in 2008. They even took his mugshot. And it took 3 cops, to handcuff this 5-year-old girl at a school in St. Petersburg, Florida in 2005. Go ahead, don't worry. She had been misbehaving in the vice principal's office, even trying to slap the teacher. We asked psychologist Jeff Gardier, what can you do to calm a child who's out of control?
We would put them perhaps in a room where there is less stimuli, so minimal furniture, making sure it's a safe room, and making sure that there is a counselor or a teacher who's in the room who can help soothe the child until the child is able to calm down.
I do understand your point for showing this example, but I think it can be seen as a bit extreme. Those that were working with that child and were called in were clearly not trained accurately to work with them. That is not how I conduct my classroom. I want to also say this. As a general education teacher, I believe that since students with disabilities need to learn how to function in the real world, especially considering that they will not always have one-on-one aides with them, these individuals should be subjected to the same disciplinary actions as their peers, their natural consequences, if you will. I say this because of past experience, where there have been many circumstances where these students have used their IEPs as a reason or sometimes as an excuse to act up in school. It seemed to me as though they take advantage of having it, kind of like hiding behind the protection of their IEP, which is provided by Fape, so we can't really say anything to it. As an educator, I feel that many of these students' modifications are not necessary as well. I believe that all students, even those with IEPs, should have the same disciplinary actions implemented as do the rest of the general education students if they want to be in an inclusive setting. I don't think it is fair to give these students more leeway in their behaviors than we do to all others.
Board Certified Behavior Analysts, or BCBAs, have a doctoral or a master's degree in behavior analysis, education, psychology, and other related fields. They have extensive training and experience in designing, developing, implementing, and evaluating a wide range of ABA and behavioral intervention programs for individuals with autism and other developmental disabilities as well. Consultation with a BCBA can not only greater support the child, but it can also provide greater support to other key players in the child's immediate environment. This includes families, teachers, faculty members, people in the community, etc. When looking and working with disruptive behaviors in the classroom, consultation with a BCBA could provide and help to clearly define the strengths and learning needs of the child. The behavior analyst or BCBA will address those needs using research-based methodologies. The behavior analyst or BCBA will observe the child's behavior in a variety of environments to develop an accurate picture of his current strength and needs. The behavior analyst, BCBA, will select procedures to address the child's various learning goals and then design experiments to determine the effects of these procedures on the child's target behaviors. The behavior analyst or BCBA can and will train teachers, faculty, classroom aides, etc., and family members so that the child will use their new skills across many people and places in their life.
Teachers use an instructional approach to manage behavior, and it helps ensure that students understand not only what behaviors are desirable within a classroom learning environment, but also how to perform the behaviors within the context of the instructional activities and interactions within the classroom. There are also tools that teachers use within the classroom for behavior management. A common and easy to understand method is a color scale. Students are given the goal to stay green throughout the day. Moving from the color yellow or to yellow or red will result in consequences. So there are ways that teachers have to handle behavior management for the classroom.
So as previously stated, I can develop a function-based intervention and an individualized plan that can be used in various settings, train the individuals to use the intervention, providing support as needed, strategies that can be implemented in the classroom. The trained individuals should, of course, be the ones who will be providing the one-on-one support to the student to help ensure that the individual knows and understands the intervention and can follow the steps during an intervention or crisis situation. Open communication is always encouraged. Our code of ethics for behavior analysts, number 1.03, addresses staying current in scientific research in the field of ABA, utilizing such things as peer-reviewed articles, various trainings, and workshops. This is to ensure that we can provide the most effective and recent interventions possible for children who are disabled and need extra support in the classroom. The BCBA would stay current, obviously, and be able to train others to use the tools effectively. Also, there are other behaviors that would need to be addressed that maybe the special education teacher or the general education teacher wouldn't see as things that need to be addressed. For instance, a child who is sitting in their seat throughout a lesson but is kicking their legs or bouncing around. This may not be seen as a problem, but what about the child who sits behind that child? That's very distracting for them. That's preventing them from being able to learn to the best of their ability. So this is just an example of a behavior that we could also take care of using a behavior intervention plan.
School placement has definitely improved since the introduction of IDEA and Fape, and this discussion is still of really high importance. It's well known that autism numbers continue to increase and that ABA is the only treatment with scientific support of being effective. The increase in diagnosis over the years obviously means that the schools have a higher population in their classrooms. And since ABA can offer benefits to all the children, not just people, not just kids with autism, it seems very reasonable to me to incorporate it into the classroom to benefit the social, behavioral, and academic goals of all the students.
Go ahead. That concludes our informal debate on our topic, which was, should a free and appropriate public education, FAPE, include mandatory ABA services for children and youth with ASD inside of schools? We do have a few questions from the audience. The first question is, what is the legal obligation behind FAPE?
I can answer that one. There is no attempt to establish any one test for FAPE. It's largely established per child. And with the Disabilities Education Act, the child is entitled to free, appropriate public education. And this includes the related services that we had talked about in the debate that are needed to support the child, such as occupational therapy, physical therapy, and speech. That is pretty much what they are obligated to provide.
Okay, thank you, Heather. We have another question, which is, what factors must be considered in determining appropriate placement for a student with a disability?
That's a great question. First and foremost, it comes down to the individual student's abilities and needs. Things to take into consideration are the educational benefits to the student from a regular classroom, say, versus the benefits of a special education classroom. Also, the benefit to the disabled student interacting with non-disabled students. There's also the degree of disruption to take into consideration. So do the behaviors result in the inability to meet the unique needs of that child, and then disrupt the other students in the classroom. And then other things to take into consideration would be the category of disability, the administrative convenience, and availability of space in the classroom.
All right, thank you, Sammy. The next question is, if ABA is so effective teaching children with ASD appropriate behaviors, why isn't it offered as a related service on the IEP if it's the most appropriate?
I can go ahead and answer that. There's two main reasons why it's not factored into the IEP automatically. The first is it really depends on the individual states and their legislations in place. Each state has different rules when it comes to looking at what is special education, what qualifies for special education, and how ABA falls under special education. The second reason is that, technically speaking, ABA doesn't fall as an educational service need or requirement. It's a behavioral service that has additional educational benefits and supports through it.
Okay, thank you, Dana. Our last question tonight is, how often should a child's annual goals be reviewed, and how do we determine whether the child has made progress?
I can answer that one. The goals of the child are reviewed on an annual basis. The goals are set up during the IEP meeting, and the IEP team agrees on goals and how they are to be implemented. The goals are set up to be able to be met during one academic period. The IEP team also sets up a measuring system of how they will determine if the goals are met or not. During the annual meeting, the IEP team will look at those goals and the data to determine which goals are made and how much progress has taken place. Once the goals are determined that they are met, new ones will replace the old ones, and we'll continue on the process from there.
All right, well, thank you, Rhett. That concludes our debate. We hope you guys enjoyed it tonight.